Hey, good morning. I just tried to go live on LinkedIn. Clearly, I don't know how to do it yet, but I tried. I'll get it next time. I still recorded my interview with Dr. Greg Kramp from the Neighborhood Health Association in Toledo, Ohio. He would like to help you understand a little bit about him and the job opportunity that is available at the Neighborhood Health Association, a federally qualified health center in Toledo, Ohio. Without further ado, here is my interview with Dr. Greg Kramp. Hi, Greg. Welcome to my first ever LinkedIn Live. How you doing?
Yeah, it's good to be here. Um, we talked about this earlier, but I'm on a bus from New York City to Washington, D.C.
How does a guy from Toledo get all the way to New York City and then on a bus to Washington, D.C.? What's your story, man?
Good news. This kind of relates to the job position, why we're talking here. Um, I'm really happy to say that working with people at Neighborhood Health Association is really easy. Um, my wife and I came here for fertility things, and they were gracious enough to give me 2 weeks time off to take care of it. So hey, we are, and fingers crossed. Absolutely.
Good luck to you.
So yeah, that's what we're doing.
That's an exciting opener to our conversation here. But the real reason I invited you to talk to me today, excuse me, is that you, sir, work for a federally qualified health center in Toledo, Ohio, and I would love to hear about just how'd you get there, Greg?
Yeah, good question. So I was with Rite Aid for as a pharmacist since 2010, and Rite Aid's now not present there in Ohio or Michigan, but that just happened this August. But I made the jump from pharmacy manager at Rite Aid to the federally qualified healthcare center, their neighborhood health association, 2 years ago. So well before it was announced that Rite Aid was pulling out. Um, there's a couple of reasons. I had a really great experience at a federally qualified healthcare center when I was at the University of Findlay as a student. And then, so I kind of knew what they were about. They're about providing patient-centered medical home for the patients. So that means kind of like wrapping our services around the patient. So we provide primary care at a number of different sites. Uh, I see you would, thank you. You mentioned that we're the largest in Northwest Ohio. I think we definitely have the most locations. I don't know all of our data on the patients served and things like that, but yeah, we're on the east side of Toledo, downtown Toledo. We're out there in Holland. We got one at South and Broadway. These are primary care clinics. So we're a community health center. Now we only have currently one pharmacy that we use to serve our patients. Most of our patients get their prescriptions through other pharmacies. We are also adding an additional pharmacy on St. Clair Street, downtown Toledo. So that's part of one of many reasons we want to expand services within pharmacy, but that's one of the reasons we are looking to hire another full-time pharmacist.
And that's why we're talking today. You're looking to hire another full-time pharmacist, but you're not the hiring manager, right? You're just trying to recruit your coworker, right?
Absolutely. Yeah, which that's something that's really refreshing about working with Neighborhood Health Association that when it comes to like solving problems there in the pharmacy, geez, at Rite Aid or maybe other big box retailers, like the change comes from on high. Hey, this is what we're going to do, and kind of like give it a program. Whereas there's a lot of times where things come up and they say, "Hey, Greg, what should we do? Let's have you help write a policy, find a solution to the problem." Um,
You mean you're
and then,
practicing at the top of your license?
yeah, you could call it that. Absolutely. I mean, I will say that, like, in that same breath of, hey, let's find a solution, what I find sometimes happening is like, I think I've got a really great solution. But similar like we have University of Toledo UTMC students that come in. I tell them like the best medication for the patient is the one that they're willing to take. And how it works, working with our executive management team, the higher ups there, NHA is like the next step they're willing to take with pharmacy, if it furthers our goals, is the next best step to take. Yeah. So like saying like your patient is going to reduce salt intake or feels comfortable taking calcium channel blocker, you put them on that. Yeah. Or you solve a problem in the pharmacy by, I don't know, implementing text messaging or alternate site pickup. We deliver to our other like locations in Holland on the east side.
Okay.
So
Do you get to work with interesting billing models or anything like that? I mean, you guys are probably a 340B
thank you.
related pharmacy. Go ahead and talk about that.
Yeah.
Not everybody gets
So
to do that.
absolutely. So as part of a federally qualified healthcare center, which I think you and I talked about before, but that means we're located in medically underserved areas. So that's a government distinction that we're medically underserved, and we apply for a license to practice. So I'm not a federal employee or anything like that. All these things have generally not affected me. But yeah, in addition to that purpose, we get our medication at the same price as the VA gets their medications at. So that they call that 340B pricing. Similar like your 401k, that's like in reference to line 401, K. There's a 340B that corresponds to saying
Drug pricing. It's,
drug pricing.
yep. I
So
appreciate
that,
you bringing that up because not everybody gets to deal with that. A lot of people just deal with, oh, do you take GoodRx or do you take this little
yeah,
plastic card or oh, here's my Medicaid card and you do a fair amount of that as well, right?
yeah, I would say that a third of our people or so are Medicaid, a third are Medicare, and we like a third are cash paying patients. And it just really feels good to be able to extend to those cash paying patients our deep discounts. We operate as an independent pharmacy. We don't have a PSAO, so independent contract um, with, say, like Express Scripts or the big insurers.
Okay. Thank you for talking about that sort of payment structure. Let me ask you something. If you are recruiting your future coworker, what are some of the things you think they need to know about the job? Like hours, things that your employer values, cool things they'll get to do. Go
Mhm.
ahead, take it away, Greg.
Yeah, thanks. Yeah, I think it's important they know that the schedule is great. We work, see, I get there like say 8 o'clock. I'm out of there by 5:30. We have an hour lunch, so we stagger our lunches. We're closed entirely from 1 to 1:30 currently. So just accommodate those lunches, give a little break. Um, see, cool things that we get to do are interacting with our doctors. So we're currently operate what they call a closed door pharmacy. So that means we only fill prescriptions for people that see our primary care doctors there. Um, which means you get to know your patients, you get to know your doctors, you have more open communication. Um, so how that plays out on a daily basis is something like, hey, your insurance doesn't cover that Symbicort medication, but let me get it switched to Dura, or or some lesser expensive alternative. And those lines of communication are open, and it just feels good to be able to know what the solution is, suggest that solution, and then, with time, have that trust build up with those regular doctors. Mostly nurse practitioners, our medical director. Um, we do have one medical doctor currently who's our director of medicine. But they're open to they're open to conversations and to suggestions. And it's great, that and like the low prices that you can charge just avoids a lot of day-to-day headaches that come up with, like, say, insulin, or we've all heard that before. Hey, I really need this, and sometimes we're able to say like for Xarelto, which this is amazing. We are able to charge $4 for a month supply of Xarelto and $10 for 90 days. So that's beats most people's copays.
Yeah, I think there's a lot of benefits to being a patient at a federally qualified health center, but also being a pharmacist at a federally qualified health center. What's the best part of your job, Greg? What's your favorite thing?
Um, yeah, thanks for asking. It's right. Don't want to give you the wrong answer because it would come back at me. No,
Quit being a perfectionist.
exactly. Um, I think it is just the ability to solve these kind of problems that come up within the pharmacy, and they're looking back to me to be that expert, which we are. Versus I was often very frustrated at Rite Aid. They don't have a real good mechanism they didn't at least, like to bubble up ideas and see that like you really made an impact. Whereas where I'm at, we're using QS1 for like constantly doing like continuous quality improvement or improving our processes and workflow to just help out the patient, help us out. So that, we're automating things versus doing it manually. So
Yeah,
that's
strategy versus crisis, I feel like is what you're referring to there.
absolutely,
Yeah.
absolutely.
I see the problem solving part of you coming into play here. You like to solve those problems, and I feel like you have more bandwidth because you don't have to do all of the retail related things necessarily at volume because it's just a different environment. Yeah. Going from Rite Aid to Neighborhood Health Association, let's just call it NHA. What really was the biggest surprise to you?
Oh boy, I mean our prices. Another thing that's like a really big difference from where how we were operating at Rite Aid versus NHA. We don't dispense any of the C2 medications. We don't carry that license. So we have schedules 3 through 5, but no C2. So no oxycodone, no Adderalls, things like that. Not that I'm against that, but that takes those kind of things off my plate, which is nice. Um, yeah, it's just we're focused on the patient-centered medical homes. So we can do a lot for them, and we do. And that feels good every day to be able to say I help someone out.
It's very pure pharmacist job you got there. That's nice. Are you glad you made the jump?
Oh yeah, absolutely. I'll admit that initially, it didn't feel great to be making a little bit less money, um, but compensation where we're at is fair. I'll say we're hiring obviously technician soon too. I'm happy that we pay them well. We pay them better than Rite Aid. We don't seem to have the kind of turnover that is endemic to retail pharmacies, say, that was the case at Rite Aid. Currently, all of our technicians are nationally certified. We have the potential to do a lot. I think that's one of the things on the horizon for us, my current work. I should also highlight that other things on the horizon at NHA are further integrating and allowing pharmacists to have a say on what the doctors are prescribing and helping out in that process. Yeah.
Drug selection. Yeah, it sounds a little bit more like you have a team environment instead of everybody kind of being in their silos. Would that be fair?
Oh yeah, absolutely. Yep. More of a team. Yeah, yeah. I see our doctors in our Nexus building. We have, let's see, Ms. Buntless, nurse practitioner. We have women's health, dental's right there. So yeah, if we want to, they're just down the hall or a phone call away. Our quality department is in there. You had mentioned different payment models. We're part of CPC Plus, so our quality department is honest about making sure we, like to say, get a certain percentage of our patients having treated blood pressure less than 140/90, or a certain percentage of patients with A1C less than 7. Yeah, yeah. It's very much a team effort.
Thank you for getting into the team part. That's cool. I know that when I worked retail at Walgreens for about 9 years, there was just a lot of silos. You know, you as the pharmacist take the prescriptions and then, the technician inputs it, counts the pills, gives it to you to check, and then they often sell it over there at the window and you stay in the same 3x3 square for 8 to 12 hours a day. I know what that's like. It sounds like your job is just a little different. So getting to the point of you're recruiting your future coworker here, they pay fairly, the benefits are good, the hours are great, the vacation is very nice. It sounds like you can actually get 2 weeks off consecutively. Amazing. I mean, a lot of pharmacists have to fight, 10 months in advance to try to schedule something like that. It sounds like you were able to do this without a problem. You're coming to us from a bus between New York City and Washington, D.C., which is really cool. And how long has this position been open? And when are they closing the application grab process here?
Yeah, so the position's been open, I'd say about 2 months. And, I'll say that our human resources department, they're experienced. They don't want to see that turnover, so they're fairly picky. They would prefer someone that has 340B or federally qualified healthcare experience, but it's not a requirement. I didn't have that coming in. Not a whole lot. The last time I had experience with that was as a student.
When are they going to conclude accepting applications for this particular position?
No, I haven't heard that there's a specific timeline. They're going to continue to accept applications until they find someone that's a good fit.
Okay. All right. They're looking for the right pharmacist, not necessarily, the best from among the applicants in a certain time frame. There's definitely a difference there.
I should say too that, like, I think a lot of pharmacists that I know that are out there looking for positions, they're been stymied by, a robot that's reviewing their application.
Does that happen at your facility? Will a robot be looking at their application?
No, not even once.
Okay.
Not that I'm aware of. It's Rebecca in HR or Mary Grace in HR are going to look at the applications personally and go through them. And, yeah, they've talked to some people and we're still looking for, right? As they say, the interview goes both ways. So it's got to be a good fit both ways. And we're still looking. So yeah, this is someone that we're looking for that's got to be patient-centered. That's going to be good with like a 9 to 5 schedule. I should also say that we had half days in the summer, half day Fridays in the summer. So that's
Okay.
been really nice too. So
Half day Fridays. I like that.
yeah,
Got a certain ring to it.
Yeah.
Greg, as we start to wrap this up, I want to compare what we're about to do to when a patient is in the room seeing the doctor. The doctor has his back to the patient, he's walking out, the exam's over, and that's when the patients usually say what was really on their mind. So, Greg, is there anything that you would like to say as we wrap this up, much like a doctor leaving the room and the patient's like, oh yeah, and this one more thing. What's your one more thing?
That I'm looking for someone that I can get along with. I think that's what our whole team is looking for. And so, yeah, please come to Neighborhood Health Association and apply. We want the best fit. So there's not like a limit of, oh, we're going to get 100 applicants and stuff or whatever. Yeah.
All right. Thank you.
Come help out people with me.
Come help out people with me. I like that. In Toledo, Ohio, right?
Absolutely.
Come work in downtown T-Town, right?
Yes.
All right, Greg, thank you so much for being with me here on my very first ever LinkedIn Live. Have a good day.